Hello, dear friends. So, here we are with the recall of FMG January Microbiology and Infectious Disease MCQs. And I suppose this time the questions were easy, bit easy. Okay, but it is not so that a lot of questions were not there. So, in and around, like actually, what I'm saying is like nowadays, no subject is coming like directly that this is there. So, it comes in a form of integration also. And yes, certain one liners were also there in the exam. So, they have touched every aspect of microbiology, like even journal and all, they have asked up in the exam. So we'll discuss up, and obviously these are recalls, and whatever you feel that this was not there and something was there, please put up in the comment section. And because the exact ones nobody knows what have come, and even one statement of a student can change the full question. Okay, so let's start up without wasting time. Which species damage the erythrocytes and reaches the brain? Okay, so basically wants to ask for the cerebral malaria, if at all this way the question was asked. And I suppose this is not the real language of the question. The question language must be different one. And obviously the answer is what? Plasmodium falciparum. Okay, Plasmodium falciparum, because Plasmodium falciparum leads to what? Cerebral malaria. And thereby, why does it do that? Because massive there is a massive parasitic load which goes up into the brain capillaries in this particular one, and they clog up those brain capillaries, and thereby there is formation of a granuloma, Durrett's granuloma, which can come up in the future exams. Durrett's granuloma, which I suppose you are not giving up for sure, but yes, for the PG, definitely you should know that when they go to the brain, it produces up a granuloma that is termed as Durrett's granuloma. And because of the massive killing of the erythrocytes, which they are saying up in this, damage the erythrocytes and all. So this culling of the RBCs being done by the spleen, and thereby that particular spleen also becomes which particular shape? A special type, that is ague spleen, soft spleen. Because of that, and this particular Durrett's granuloma. These two words ought to come in the future exams, and you should note them. Okay, and if you are a NEET PG aspirant, you should focus upon these particular ones regarding the Plasmodium falciparum. And as far as the discussion part in the notes of my is concerned, and I'm happy to tell you that most of the questions, again, they were from the notes itself. And as you can see up, I have told up Plasmodium falciparum, cerebral malaria it does. This was, if at all, it is there in the exam. So this is from there done. Durrett's granuloma is formed up. This is histopathological picture of it. And this, because of the massive culling of the RBCs, what happens? That is culling, or you call it as killing. Okay, so CULLING, that is also termed as culling. So ague spleen, soft spleen, and these are the complications which ought to come up in the exam in the future ones. Chaplain, so coma, hypoglycemia, anemia, pulmonary edema, lactic acidosis, infections, and the necrosis of the renal tubule. So this is our notes from the ALLENNExT, in which this particular things along with this extra information is there. Okay, so they are the latest one of mine, and definitely a lot of things in and around them only have come in the exam. Okay, so let's have the next one. The patient complains of a hypochondrial pain. Okay, in the hypochondrium the pain is there. Had a pet animal, that is the dog. A radiological imaging shows multilocular cyst within the liver. What will be the organism doing it? If it is like written up multilocularis, so answer would go in the favor of multilocularis. And if like some they are saying it is not there in the exam, then obviously it is a Echinococcus granulosus. So whatever is the option, according to that the things will go. Okay, so Echinococcus granulosus, which is also termed as dog tapeworm, should be the answer here as such. And if it is like written a multilocular cyst, and also it is seen up in the multilocularis. Okay, but this is also important, that is it being written dog only there? If it is being written up, then either of them might be the answer, and multilocular more goes in the favor of multilocularis. Okay, other options are relevant, and you know that the definitive host in this particular one, the definitive host in this particular cystode is what? In this particular cystode is D for D, that is dog. And what are cystodes? And cystodes are termed as what? They are termed as tapeworms. Cystodes are termed as what? Tapeworms. Now this we have done. This is the like screenshot of the notes of mine, And in this, obviously, we have discussed of this, that is the hydrated cyst being done by this particular Anacoccus granulosus, which is termed as dog tape form. And how does the infection happens? Infection happens by eating the eggs, okay, with the contaminated food and water with the eggs, okay. So this you need to know in this particular one. Now, it is being asked like the primary identification made by the CB-NAT or gene expert. And the CB-NAT, you know guys, what is CB-NAT? Cartridge-based nucleic acid amplification test. The other sophisticated name of what? PCR. Okay, and gene expert is the other name of it. So basically, the full name is Gene Expert RIF, that you already know. The full name is what? Gene Expert RIF. And this particular RIF, this tells about what? Rifampicin resistance. And I suppose this was asked. Okay, so MTV with rifampicin resistance, and the other one likely which can come in the future exams is that which particular gene is being targeted. The answer is RPOB gene. Okay, this particular gene is being detected with the help of the CB-NAT or gene expert RIF, and thereby it tells about what? It tells about the rifampicin resistance. So whenever it is being like telling up that the organism is rifampicin resistant, so obviously it will be isoniazid resistant also. In most of the cases, not always. So it gives you a hint that you are dealing with what? You are dealing with the MDR-TB. So that's what the use of the CB-NAT or gene expert. Okay. Now this I have already told up that CB-NAT or gene expert RIF and rifampicin resistance is being detected up, and this particular RPOB gene is being detected. And the good thing about it is that you have the results within what? 2 hours of the process. So it's very fast. Okay. Now coming to this, HIV patient, 45-year-old, presents with fever, persistent headaches and confusion. The CSF analysis shows a positive Indian ink stain on the lumbar puncture. What is the diagnosis? So if this was the question, then there is no doubt Cryptococcus neoformans. And I've heard of in the students' discussion, they told up regarding the diplococci. Okay, if diplococci is being written off, 2 particular things can happen. So diplococci is one of the diplococci is pneumococcus. Okay, one of the diplococci is what? Pneumococcus, and another one is meningococci. Okay, these are termed as diplococci, and interestingly, for them also you can do Indian ink staining. Okay. For them also, this negative staining can be done. Okay, so if it is written up diplococci and all, and if these options were there, then you might think about them also. But if it is directly written like this, HIV patient CSF analysis shows a positive ink stain, and diplococci and all is not being written, because most common cause of meningitis in HIV positive is definitely Cryptococcus neoformans, which is a true yeast. Is it fine, guys? So remember in this particular sense, and if diplococci is being written there, so the gram-positive one, the gram-positive cocci is pneumococcus, and the gram-negative one is meningococci. And both of them, they can do meningitis. Even in HIV positive, they can do that. And for them, you use up this Indian ink staining. And if it was there in the exam, then definitely some twist was there in the question. They want to know that Indian ink staining can be done for a bacteria also or not. Yes, it can be done. Okay. So this is there. Now, there was a question regarding this particular one that they have asked regarding the gram-positive cocci in chains, and you know that Streptococcus pyogenes and viridins are there. The pyogenes have short chains and viridins have a long chains. Besides that, what you need to know, like was asked is, I suppose they have given up the history of rheumatic heart disease. Okay, so rheumatic heart disease shows up like this was being written off, and they have gone for the blood culture and all, and in that they could able to find the gram-positive cocci in chains. Is it that way the question was? So the real version I really don't know, but if it is that way and the gram-positive cocci in chains was asked and they have given up, so you already know that Streptococcus pyogenes is the main culprit which does it. It's a beta hemolytic strepto. What it is? It's a beta hemolytic strepto, and it is also termed as group A strepto. And as we have done in our app, that group A strepto, this particular Streptococcus pyogenes which we are talking about, it leads to two non-suppurative complications, and two non-suppurative complications of group A strepto, what they are? क्या है वो? Group A strepto की non-suppurative complications, एक है दोस्तों ARF जो कि acute rheumatic fever है. Another one is AGN. And what is AGN? AGN is acute glomerulonephritis. What is AGN? Acute glomerulonephritis. And obviously you know that which one have a good prognosis? AGN have a good prognosis than the ARF. Okay, and this ARF, if there's no carditis, still you have to give a prophylaxis, and that can vary for 5 years and up to 21 years of age. So that is there. And if it is a carditis, then up to 10 years you have to give the prophylaxis of penicillin, or up to 21 years of age. And if it is confirmed upon echocardiography that there is a valve involvement and all that in this, then you have to go it for 10 years or 10 years prophylaxis, and up to 40 years of age, that particular one is to be given. Okay, so that is a table of Harrison from which you can find out that if there is a carditis or valvular involvement and all, what to do and how to give the prophylaxis and all. And this is important. This can come again. And this particular thing, that after having the infection of sore throat and all, how does this ARF and AGN happens? So basically, this particular phenomena might be asked later. And this phenomena is termed as what, guys? Molecular mimicry. You call it as what? Molecular mimicry. They cross-react. Certain antigens which are there in the streptococcus, like carbohydrate C and M protein, they cross-react with the cardiac walls and the myocardium. Okay, so that thing also should be in your mind. And this we have discussed up regarding the cocci in the chains and all. Okay, and we have talked about acute rheumatic fever, and we have talked about these all things. Okay, so this is very clear that rheumatic fever strongly correlates with this. A gram stained, obviously positive in the chains, and regarding the pyogenes we are talking about, because they are the non-suppurative complications which I just told you that there is no pus, इनमें pus नहीं होता. ठीक है? Okay. Now coming to the next one. Now this was there, the reservoir of the Kala Azar, and you know Kala Azar is done by Leishman and Donovani, and the transmitter of this particular one is a sandfly. The transmitter of this particular one is a sandfly, okay, which is also termed as phlebotomous urgentipus. Important is the reservoir they have asked. Reservoir is a human, men. Reservoir is human, that is men, of this particular Kala Azar. So this is also an important point to be noted. The reservoir is only men. And there are other things which are in and around this, those amastigoid forms, promastigoid forms. The drug of choice is being asked, that is LAMP, and RK39 antigen card test is done for the Kala Azar, that you already know. Okay, so if this is a question reservoir, so answer is men, humans. Okay, and in the humans, which is the infective form for the humans? The answer is promastigoid. And promastigoid is what? Flagella or aflagella? It is flagella. Okay. Now this we have discussed up regarding the Kala Azar, and we mentioned up this thing also, that the sandfly is responsible for this, and this is what is visceral leishmaniasis, the other name of Kala Azar. And these all are the findings which are being seen in the Kala Azar. And Leishman and Donovani is there, which involve the visceras and all. So this is also being properly discussed up, and the infective form, as told you, is promastigoid, which is there in the sandfly. Okay. Now, whenever we talk about Kerala, a lot of viruses in our mind, and if this was there, a 15-year-old boy presents fever, headache, and drowsiness, consumed palm fruit. Okay, so this 15-year-old one have exactly this is what is the coconut palm syrup. Okay, so palm fruit, it is not palm fruit, this is palm. Okay, palm fruit. Recently, which virus should be considered in differential diagnosis considering the geographic location? If this was there, so obviously we are talking about what? Nipah. Okay, and Nipah, I've already told you what is subfamily, Hanipa. And this particular one, the reservoirs. Reservoirs are what, guys? The reservoirs of this particular Nipah virus, they are fruit bats. Okay, the reservoirs of fruit bats, and the transmitter of these particular ones. Okay, the transmitters of these particular ones are what? Like, how does it transmit off? So contact with the secretions of the fruit bats. Contact with the secretions of the fruit bats. Fine. Which secretions of the fruit bats? Mostly urine. and they what they contaminate mostly, any water stuff or this coconut palm sap, they used to have it there, and that was being contaminated with urine secretions of it. Other than that, the fruits, they are being contaminated up, and if somebody has them, then they develop this Nipah stuff, and it's a paramyxoviridae member, okay, paramyxoviridae member, and the mortality is very high, that is more than 70%, and investigation of choice, that is RT-PCR, okay. Now this we have discussed up, Nipah virni. The fruit bats are the reservoirs, also termed as flying foxes, and the amplifiers are what, guys? Pig. And there was a question in AIMS also in which they have written up these things, and they have given a picture also besides that there are fruit bats, coconut trees, so that suggests a Kerala, okay, and the pigs were there in that particular picture, and they asked up that which virus associates. The answer is Nipah, okay. Belonging to which family? That is paramyxoviridae, okay, that is paramyxoviridae. Orthomyxo is having what? Influenza, ABC. Now, this question came, the control for the ethylene oxide, and the answer to this obviously is what? This one, Atrophius. And remember guys, the Atrophius is used for hot air oven, okay, and it is also used for ETO, that is ethylene or ethylene oxide. And this particular ethylene oxide is a high level disinfectant, commonly used in the hospitals, and this particular ethylene oxide, okay, it is in the this particular one is high level disinfectant, and it's used for what? It's used for catgut sutures, okay, it's used for catgut sutures. Other than that, it is being used for pre-packed syringes, okay, and all your ICU equipments, heart-lung machines, okay, heart-lung machines, respirators, they all are being sterilized by what? ATO, which is even inflammable, okay. Explosions can also happen up, but still it is being used because it is cheap and it is having a high level efficacy. So to test upon whether the ETO is working fine or not, because there's a sterilizer, comes in a form of apparatus, okay. So you use up Atrophius, okay. So Atrophius is used for both hot air oven as well as ETO, and this have come. I suppose you must have excluded up the things and able to reach up to the answer. Otherwise, in the book, this name also is being written, that is Globigi. The Bacillus globigi is also being used as a control. What is the control, guys? Control is that in which you want to test upon that whether your instrument is working fine or not. And the testing you have to do with some biological indicators. And some of them is these Bacillus species like Atrophius, Globigi, Pumilus. Okay, so Pumilus is there, and along with that we have Bacillus stereothermophilus, which is being used for autoclave and plasma sterilizer. So these all important things you need to know. Clostridium tetani, non-pathogenic ones, they were used to be used for what? Hot air oven before. So these things are also there. Okay, what is there for the filtration and all? So filtration, you have Briondemonas diamonata, Serratia marcescens, that are being used for the filtration and all. Other than that, for the radiations and all, you have that Pumilus. So these names might come in the exam in the future ones also. So you should know these particular names. Like for Pumilus, it is for these ionizing radiations and all. That is the control for them. For the filtration, you have just now I told you, but a tough name is Briondemonas diamonata and Serratia marcescens. And for this ETO, you should know that it is a Globigi and Atrophius. Both it can be. And stereothermophilus is plasma sterilization and autoclave. This is what is the biological indicator, the control for the ethylene oxide, which is being very commonly used in the hospitals. Okay. Now, somebody was telling this sort of a question also came that a patient is there with meningitis and CSF shows lymphocytosis. Okay. And along with that, important is this, that if the glucose levels, they are being given normal, then goes towards something else. And if the glucose levels, they are decreased off, not much, but they are decreased off, then the things goes towards any other thing. Okay. So this also you should tell in the comment section that what was the exact one. So lymphocytosis was there for sure. And the glucose, if it is normal, it goes in the favor of viral or fungal ones. And if it is less, then it goes with the favor of TBM, that is cobweb coagulum. Okay, cobweb coagulum, you know, na? So that associates with this high increase in the proteins, along with a decrease in the glucose and the lymphocytosis. That is being observed in the case of TBM, whereas if the glucose is normal and all other parameters are somewhat slightly increased or normal, they are there in the viral and the fungal meningitis stuff. So again, you have to decide upon that what is being given off, and if it is all the bacteria, then it is MTB for sure. And if it is not all the bacteria as the options, and there was like fungus or some virus also being given off, then you have to think of that what was written and all. And then you have to, that main focus will shift on what? The protein levels and all. So that also you need to know. Okay. And this obviously, I have a very good video on my YouTube channel by my name, Dr. Sonu Panwar. And in that we have discussed organism wise also, that which all peculiarities can come up in the exam, and these particular things also is being discussed up. Okay. Now, there was a question regarding the mite bite was mentioned in a patient with fever, rash and eschar formation. What is the most likely diagnosis? The most likely diagnosis of this obviously is what? Scrub typhus. If there is a formation of a black eschar, then you should think for three things at least. One is cutaneous anthrax, one is this scrub typhus, and along with that, even in the COVID-19 stuff, that is rhinocerebellar zygomycosis, it might goes to the orbits and thereby formation of black eschar. Why is it forming black eschar? Angiothrombosis is there. What is there? Angiothrombosis, and because of the angiothrombosis, there is a formation of black crust. So that also comes in a DD of this. But clearly it is mentioned a mite bite. So we are talking about what? Scrub typhus, done by what? Orantia susugamosi, and common in where? In the hilly regions and all. Which test is done? Wheel Felix test. Which particular tetrad is seen? Zoonotic tetrad. That is observed in the scrub typhus. And what is the drug of choice? Doxycycline. So all these are mentioned of. If it is written, so directly it is scrub typhus. And this is there in my notes, this particular table. A lot of questions, they come in and around this. And clearly being written scrub typhus, done by Orantia susugamosi. The vector is mite. And the rash is present in 50% of cases, eschar is present in 35% of cases, and the lymphadenopathy is there in the case of scrub typhus. So you should see this particular table before the exam. Definitely one or two questions, they come from this particular table only. Okay. So epidemic typhus, Prowazeki, endemic typhus, Rickettsia typhi, Rocky Mountain spotted fever, Rickettsia rickettsii, Indian tick typhus, Conori, rickettsial pox, Akari, and scrub typhus, Orantia susugamosi. Okay, so these are there. Now, the same, they were telling like it was with a flea bite and all, you should tell up whether it was there or not, along with the fever and lymphadenopathy, that was mentioned a flea, that is endemic typhus. And how we come to this conclusion, again you see this particular chart, that is the table, and in this the flea comes up for the endemic typhus only. And remember, lymphadenopathy as such is absent. So this again have to be seen up whether it is being written lymphadenopathy or not. Because eschar is also absent, lymphadenopathy, both are absent in this. Okay, but rash is present, and that too over the trunk in the case of what? Endemic typhus. And this is done by this Rickettsia typhi, as we have learned also by the various mnemonics, all these particular ones. The vector. From about onwards, if you go in a sequence, the vector sequence is what? Louse, flea, tick, tick, mite. So you have to do that because questions are coming according to that. This might have come, this flea have come, and again they will come. Okay, so remember this particular table in the important way for the microbiology stuff. Okay, for sure you will find them somewhere else. And what is drug of choice for all of them? Doxy. Okay, the drug of choice for all of them is doxycycline. Now, so if it was the most simplest question, the curdy white vaginal discharge, the pH decrease here in this particular one, done by what? Candida albicans. Okay, and there is a pseudo hyphae. Okay, and let me tell you regarding the Candida albicans that this is the one, this is a fungus which can show up any form. Like it can be a true yeast, it can be a yeast-like, it can be having a hyphal form, true hyphae, it can be having a pseudo hyphae. That is termed as constrictions. Pseudo hyphae is what? It's the elongations along with constrictions. That is pseudo hyphae. So obviously we are talking about which particular thing? Vaginal candidiasis, in which there is a curdy white discharge. So if it was there, so obviously. So that was like easy one, which is there in the exam. And we have discussed up regarding the Candida in this, and we have mentioned up in the notes also like pseudo hyphae and all this is present. These are the colonies of it. And another question which have come in the aims is this one. That has also been discussed in the notes and all, along with the app, obviously. Okay, so these are the conditions in which the Candida infection happens. They predispose to the candidiasis. that is intravenous catheters, hyperalimentation fluids, indwelling urinary catheters if somebody is having, parenteral glucocorticoids, abdominal thoracic surgery, cytotoxic chemotherapy, immunosuppressive agents for organ transplantations, respirators, neutropenia, low birth weight, diabetes, along with the burns. Okay, these all conditions are predisposed to what? Candidiasis. And this was asked in the AIMS exam, obviously with accept and all. And this is the chromaga which is being used for the speciation. Okay, so all these in a very particular, concise manner is being given up in the notes. And if you do that, okay, most of your questions will be done for the INI-CT along with the NEET PG also. And it will be definitely beneficial for you. And for these particular questions, you do tell me that there were these questions or not. Somebody told up that something related to Vibrio regarding the difference have come between the classical and LTOR. Do tell me up whether it was there in the exam, the classical and LTOR, that how to differentiate between them. So obviously you do this particular test, polymyxin B, and polymyxin B sensitivity is positive in the case of classical and it is negative in the case of LTOR. Means polymyxin B kills up the classical Vibrios and LTOR is being killed not by this polymyxin B. So it is resistant to the polymyxin B, that you need to know. We have discussed in the app also that polymyxin B is one of the tests. Then you have Mukherjee Phage 4 assay which can be done and number of others are also there. And Mukherjee Phage 4 is also positive in what? The classical one. So do tell me in the comment section that oven Vibrio was asked or not. Because if this was asked, so it is also being covered up in the app and the notes. So you should tell me what was the exact question regarding Vibrio. Was it there or not? Because that's why I've kept it in the last, that whether it have come or not. Fine. Now, Fournier's gangrene, the gangrene of the genitals, that is mostly the scrotum is Fournier's gangrene, and this, if it is there in the exam, you know that this is polymicrobial. Initially, the aerobic bacteria, they do that, and later on anaerobic, they take the terms to do the Fournier's gangrene, and E. coli is one of them which does it, along with the anaerobic stuffs also, which does the Fournier's gangrene, and basically it's a gangrene of the scrotal region, that is the genitals. So if it was there, I suppose this might have ended up your quest for knowing of the organisms of the Fournier's gangrene. Now, somebody was telling up in the comment section that it was regarding something about the blood culture also in the case of infective endocarditis. Was it there in the exam, guys? So for this, I want to end up the controversies and all, and I like to tell you, if this was there, so in total you take 3 sets of blood culture. For the infective endocarditis, 3 sets of blood culture are taken up. Every set is having 1 aerobic and 1 anaerobic. Okay, every set is having what? 1 aerobic culture and 1 anaerobic culture, and these particular cultures, they should be taken from different sites 1 hour apart, because there is an intermittent bacteremia in the case of this particular infective endocarditis. This also to be there. 3 sets of blood culture are to be taken up. Then if that was not in the exam, then you can do another thing also. That is 2 aerobic cultures and 1 anaerobic cultures. Okay. So basically 2 aerobic and 1 anaerobic. That can also be done. Okay. This particular set is also there. Means if you're doing it for the first time, you have to take the 2 aerobic ones and 1 anaerobe, like that. Okay. To increase the yield of your stuff. So basically, as such, 3 sets, here also the 3 sets per head. 2 aerobic, 1 aerobic is 3 sets only, na? You have taken 2 aerobic and 1 anaerobe. So basically, in total, how many? 3. And here it is what? 1 aerobic, 1 anaerobic. So number is 2, but you are doing it for how much time? 3 times, 3 sets. Means in total, 6 here, and in total, 6 here also. Okay. How come? That is 2 aerobic and 1 anaerobic. So 2 aerobic means the firstly you have taken up the 2 aerobes bottle, you have put the blood into 2 aerobic bottles and 1 anaerobic bottle. So that will be 3 in the first go, and again it is 3 plus 3. Whereas here it is what? 2 plus 2 plus 2. So don't get confused up. In total 6 bottles here also, 6 bottles here also. If that was there in the options, then you can go for this also. in the case of infective endocarditis. This comes in the major criteria. The blood culture comes in what? Major criteria of the Dukes. Fine, along with the echocardiographic changes. Now, somebody told that, sir, there was a question regarding the crepitus also after like some road accident or something else. And then they told up that there was crepitus. And if that was there, obviously you're talking about what? Gas gangrene. And which organism? Clostridium perfringens. Which particular enzyme which does this thing very fast? That is alpha-lecithinase. Also termed as what, guys? Phospholipase. Okay. So along with that, if anything else you think that it was in the hepatitis being asked or in the HIV being asked, so you can tell me in the comment section. Regarding leptospirosis, you can tell if at all something was there in the leptospirosis or something from the fungus was there, like from the COVID-19 stuff, mucormycosis and all that. Along with that, you can tell, like somebody was telling, like it was being asked that in which the partner treatment is being done. Okay. And this also we have discussed up in our videos. The partner treatment is needed in the case of trichomoniasis. Okay, trichomoniasis, and this is a STD, and that's why the partner also needs to be treated with metronidazole. So that is one of the stuff in which you need to treat the partner also. And regarding trichomonas, you know that particular thing that there is no cystic form. There is only the trophozoite form, which shows up which motility, guys? The twitching motility of this particular one. Okay, so all these are the important ones, and along with that, do tell me if at all we are missing up on any, like what do you say, any parasito questions like protozoology or helminthology. So do tell me up any viral ones if you see, like come from HPV stuff, come from something like related to the influenza, swine flu, COVID. Okay, so do tell me up in the comment section. We'll love to answer up. And thank you so much. And I hope with the paper being so moderate this time, most of you will pass. And I suppose by my lectures and by my these notes and all, I was fruitful for you in some sense and all. And along with that, we have done a lot of online sessions also. And from that, definitely in and around these particular things, they come around. Less of it is there, but whatever, even 1 mark is being considered for passing up. And I hope I helped you in your journey. So thank you so much. Bye-bye. Take care.